Now let's examine common examination procedures for the orthopedic patient that the physical therapist uses to diagnose a problem, establish an evaluation, and design a treatment plan. As we have discussed previously, the examination consists of a subjective and objective component. The subjective exam is the patient history. It is a qualitative measurement based on the patient's perception, and if well done, gives a good idea of the problem. Typical questions include: what was the cause of your injury? What are your current symptoms? Have you ever had previous physical therapy? And other past medical history questions. A common line of questioning regarding pain includes the use of the verbal pain scale. The patient is asked, on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain imaginable, such as sticking your hand in a fire, how would you rate your pain? This is something that the PT uses during the examination process, but also the PTA will use on a daily basis. The objective exam, which occurs after the patient history is taken, consists of both qualitative and quantitative measures. The purpose is to establish baseline values and observations for later comparison, and also to try to rule in or rule out certain conditions. Observation is a qualitative measurement tool in which the physical therapist is observing the patient. This includes observation of movements such as ambulation and transfers, in other words, walking and standing from a sitting position as examples. Other observations can include an examination of posture, obvious deformities, joint subluxations, asymmetrical body contours, swelling, and color and texture of the skin. Another examination tool is range of motion assessment. Active range of motion is the ability of the limb to move voluntarily through an arc of motion. Active range of motion is assessed using goniometry, which is a quantitative method in which the degree of possible joint motion is measured. You can see in your slide a goniometer, and this is measuring knee range of motion. The physical therapist will measure both sides to get a comparison of the affected and unaffected sides. Passive range of motion, which is the amount of movement at a joint produced by the therapist without assistance from the patient, may also be tested. The term used to describe a joint with less than functional range of motion is hypomobile. An example of this could result from prolonged immobilization. The term used to describe a joint with excessive motion is hypermobile. An example of this could be a chronically subluxing joint. You should become familiar with these terms. Another common examination technique is manual muscle testing. Using manual muscle testing, the physical therapist will examine strength. Strength is defined as the amount of force produced during a voluntary contraction. Manual muscle testing is depicted in the slide where the PT is providing manual resistance to test the strength of the subject's lower extremity, as depicted here. Other examination procedures which the physical therapist may employ include flexibility, functional assessment, and special tests. Flexibility is the ability to move a limb segment through a range of motion. Although very similar to range of motion testing, the goal here is to see if movement restrictions occur from muscle tightness. Almost all orthopedic conditions can be linked to muscle imbalance. The example in your slide is tight hamstrings causing low back pain. Functional assessments or tests are also commonly used for patient examination. These include tests of bed mobility, transfers, and ambulation as applicable. Bed mobility would be someone's ability to scoot in bed. Transfers would be someone's ability to go from a lying position to a sitting position to a standing position. And of course, ambulation refers to walking. Functional assessments may also be work-specific. As depicted in this slide, a person is lifting a crate from the floor to a standing position. This may be used to evaluate someone's ability to return to work. Functional assessments focus on activities of daily living and work functioning. Examples of activities of daily living can be found in your text and include ambulation, transfers, and grooming as examples. You should look at this chart regarding activities of daily living. These are commonly referred to in physical therapy. Another category of examination techniques often used are special tests. Special tests examine specific joints and/or structures to indicate the presence or absence of a particular problem. Examples are to follow on the next slide. In the upper left-hand corner of the slide, you see a picture depicting Phelan's test, right here. Phelan's test is a test to rule in or rule out carpal tunnel syndrome. The patient is asked to hold this position, and if symptoms occur in the wrist and hand in the distribution of symptoms we know are indicative of carpal tunnel syndrome, then the test would be considered positive. In the upper right-hand corner, you see a picture depicting the Hawkins-Kennedy test. If the patient experiences pain in the shoulder with this positioning, then impingement syndrome of the shoulder is suspected. And the final example at the bottom of your slide is a picture depicting the Lachman's test. In this test, the physical therapist is pulling the lower leg forward. If it moves excessively forward, it is indicative of an anterior cruciate ligament injury. So as you can see, there are various special tests to rule in or rule out specific pathologies. So what do I exactly mean by ruling in or ruling out? Well, let's use Phelan's test as an example. If we suspect someone has carpal tunnel syndrome based on the history that they've given us, we may attempt the Phelan's test. If the symptoms are reproduced, this rules in carpal tunnel syndrome. However, if the symptoms are not reproduced with this test, it rules out carpal tunnel syndrome. Another critical examination tool is palpation, or the sense of touch. Touch is used to assess the skin and involvement of other structures. The examiner feels for pain and tenderness, areas of restriction, swelling, and structural orientation. In your slide, you see someone palpating the ligaments of the ankle. As well, in some cases, sensation testing is warranted. For example, if a patient is complaining of numbness, it is critical to assess the area. You can see someone assessing light touch with a brush here in your slide. Assessing sensation can help the examiner diagnose a specific problem and is also necessary information for guiding treatment decisions. For example, It would be inappropriate to place a hot pack over an area of decreased sensation. If a patient cannot sense temperature, they may suffer a burn. And finally, there are several other diagnostic procedures such as X-rays, MRIs, CAT scans, and neurologic testing that we will cover more fully in subsequent lectures. These types of diagnostic procedures are ordered by physicians and are useful for physical therapists in forming a diagnosis based on their examination procedures and these types of diagnostic tests. So in summary, we covered common musculoskeletal conditions and examination methods common to orthopedic physical therapy.